I work with Makerere University School of Public Health in Uganda, and I'm also the team leader for the Future Health Systems group in Uganda. Private providers have a large role to play in the provision of health services. In Bangladesh, we saw the village health doctors. In the presentation by the World Bank, we saw that a lot of people go to private sector providers. And also in Uganda, we saw that the voucher program was working with private providers for transport, but also private providers for maternal health services. And the thing that comes out is the fact that at times there is inadequate capacity within the private sector. That affects the quality of services that they offer. So much as they are available, a lot of effort needs to be put into building their capacity so that we can maximize the potential that we can get from the private sector to complement the public sector, because we need both the private sector and the public sector to provide efficient, accessible, quality services. So that came out very good. Again, one of the issues that comes out from the Uganda presentation is that we find that this program is a program that is working and increasing access to maternal health services, but the issue is how can we sustain the benefits that we're getting out of this program. So there are a few specific things that need to be addressed to see how we can be able to continue providing the right incentives for the providers to provide quality services, and also how we can provide the right incentives for the clients to continue coming and continue subsidizing the services, because we've seen that by subsidizing the finance or the cost of seeking care, both for transport and paying for the services, we've seen an increase. But the other thing is also the fact that we need a comprehensive strategy that looks at not only the demand side but also the supply side issues, because if you create demand and then the quality of services that you're getting is poor, then it's not as successful as we'd like it to be. So we need comprehensive strategies that will look at both these aspects. Just the last thing I wanted to say, especially from the China presentation, you see that the issue of management and leadership is a crucial thing at health facility level. They may have the resources available, but the way these resources are used and prioritized will influence the performance of the units and eventually the benefits that you get from the investments that you make in the facilities. So putting more emphasis in building management capacity in the health facilities is an area that needs a lot of attention.
Thank you very much.